Hey there, this is Jacqueline Sweetapple here, talking about what can be done in the prevention of disordered eating and eating disorders in type 1 diabetes. Because type 1 diabetes is most often diagnosed in children, I wanted to focus on young people, especially because one's youth is a time at which risk for developing eating disorders is also increased. People with diabetes, or PWD, are twice as likely to develop disordered eating or an eating disorder than their peers without diabetes. This is due to a variety of circumstances, but the hypervigilance around food and eating time should be considered the key factor. Between reading of nutrition labels and weighing and measuring of food items, people with diabetes are expected to know the carb content of anything they consume. Also a major factor, the weight loss experienced by patients prior to diagnosis of type 1 diabetes and the subsequent rapid weight gain following the initiation of insulin therapy can clue these people in that omitting insulin will result in weight loss. No matter when a person realizes the consequence of insulin omission resulting in weight loss, it's going to be a source of temptation. Throw in all of the social pressures of adolescence, and you're treading in pretty dangerous waters. Countless studies are published on the treatment of eating disorders and type 1 diabetes, or EDT1D. There is very little research done on the prevention end of things, but I did find one very well done preliminary study that was completed in 2003. It utilized many of the findings of those countless treatment studies and applied them preventatively. The study, called the Priority Trial, operated off the basis that the parental involvement is the critical factor and these children and young people, just like anyone else, would respond best to sound reasoning and reinforcement, which is where this information, motivation, behavior framework comes in. The information, motivation, behavior skills framework has been successfully employed in many chronic conditions such as type 1 diabetes. In short, the model looks to prevent a behavior, in this case the omission of insulin for weight loss, by first informing the individual about the risk to themselves, second, by motivating the individual to address the risks, and finally, by instilling the self-assurance to address the risks in different situations. Taking a closer look at this study in particular, they used the IMB framework to address a variety of interventions and behavior change skills, and I just wanted to read through a few of these because they are really just so well done. Some of the interventions included appropriate communication around food and weight and the recognition of the early signs of disordered eating, and also the encouragement of the identity development of those young people so that they can continue to develop them alongside type 1 diabetes management being done safely. Other interventions that they looked at were accommodating a range of appropriate eating behaviors alongside type 1 diabetes management. They also looked to encourage the growing independence of the child in their type 1 diabetes management. Parents were taught how to disseminate this type of information to their children during two-hour workshops. This included written, verbal, and visual means. The parents were also taught about methods they might use in motivating their children, such as motivational interviewing. Social motivation methods were also taught, which included more external sources of motivation, such as parental social support and setting SMART goals. Finally, a great many behavioral skills were taught, including CBT and DBT techniques. Now to wrap things up, I'll give recommendations for preventative interventions which closely mirror that of the priority trial we just looked at. They include parental involvement. The implementation of interventions hinge on parents being the mouthpiece, so their involvement is critical. Information. Providing children and young people with facts, not as a scare tactic, but just as another piece of the puzzle, is going to be the foundation for which the rest of the interventions can rest. Motivation. The way in which young people are motivated largely does come down to fear-based decisions or that of decisions resulting from instant gratification. Obviously, weight loss from insulin omission falls under instant gratification, which is why it's tempting for many people, and the work required to prevent these actions won't be instantly gratifying. The temptation then is to scare our young people into behaving a certain way, but research tells us that this does not create a sustainable behavior. Parental modeling, basically walk the walk. Finally, let's change the way we talk about food and blood sugar control. So, not labeling foods as inherently good or bad, and the same goes for blood sugars. If your blood sugar is high, maybe use terms like above target, because this is relative, and all of this good and bad talk gets internalized on a deeper level. So I know this was short and sweet, but I hope you enjoyed this presentation about the psychoeducational parenting intervention and the prevention of the development of disordered eating in children and young people with type 1 diabetes. Thank you.